Symptoms and signs of cystic fibrosis (CF) is a chronic progressive disease that can present with protein and fat malabsorption, liver disease, cholestatic jaundice, or chronic respiratory infection. Chronic cough, poorly controlled asthma, recurrent pancreatitis, nasal polyp, and chronic sinusitis that can also be presenting manifestation. Digital clubbing is common in patients with CF. And 90% of patients with CF are born with exocrine pancreatic insufficiency, inability to excrete pancreatic enzyme into the intestine. This leads to malabsorption of protein, sugar to a lesser extent, and especially fat. Fat malabsorption manifests clinically as a steatorrhea, large forced melting stools, deficiency of fat-soluble vitamin A, DEC, and failure to drive protein malabsorption can present early in infancy as hypoproteinemia and peripheral edema. CF-related diabetes may develop. The failure of sweat ducts to conserve sodium and chloride may lead to hyponatremia and hypochloremic metabolic alkalosis to reproductive dysfunction in both males and females. In males, congenital absence of the best difference and azoospermia are nearly universal. In females, secondary amenorrhea is often present. GI system mechanism illness, failure to drive malabsorption, exocrine pancreatic insufficiency, steatorrhea, deficiency of fat-soluble vitamin, liver and bile duct abnormality, and respiratory system bronchiectasis, nasal polyps, recurrent productive cough, and pulmonary infection (MIC). Health tips is digital clubbing due to respiratory insufficiency, sweat gland, and salty sweat, urogenital, male, and infantile. One, reduced fertility. Amenorrhea, cystic fibrosis is a genetic disorder that affects the exocrine glands, leading to the production of abnormality, thick and sticky testis mucus can cause blockage in various organ systems, particularly the lungs and digestive system. The symptoms and signs of cystic fibrosis can vary widely among individuals and may develop or change over time. Commonly, manifestations include respiratory symptoms, persistent cough, often productive, bringing on thick mucus, recurrent chest infection, broken bowel, bronchitis, or pneumonia due to mucus obstructing the airways and trapping bacteria, wheezing and steatorrhea, the breath, difficulty breathing and wheezing, especially with physical activity and other congestion and sinusitis, current stiffness and sinus infection due to mucus buildup, and digestive symptoms, poor growth and weight gain, difficulty absorbing nutrients leading to malabsorption and failure to drive steatorrhea, bradycardia, and forced melting stools due to malabsorption of fat. Intestinal blockage, particularly newborn meconium illness, blockage of the intestine by thick meconium can be a first sign of CF. Rectal prolapse occurs in some children due to the strain of passing thick scoop. Distal intestinal obstruction syndrome (DIOS), a condition similar to a bowel obstruction with symptoms like abdominal pain, nausea, and vomiting. Other symptoms and signs: salty, tasting skin. Parents may notice that their child's skin tastes salty when they kiss them. Clubbing, enlargement, and rounding of the fingertips and toes due to chronic low oxygen level into the blood. Delayed puberty in some adolescents due to nutritional deficiency, infertility, particularly in males due to obstructed vas deferens. Female may also have reduced fertility due to thick cervical mucus, additional complication. Cystic fibrosis-related diabetes, a unique type of diabetes associated with CF, arising from insulin insufficiency due to pancreatic damage, liver disease. Some individuals develop liver problems, including cirrhosis, due to buildup of thick bile, osteoporosis, increased risk due to malabsorption of vitamin D and calcium, as well as other factors. The severity and combination of symptoms can vary significantly among individuals with CF, and not all symptoms are present in every case. Diagnosis of cystic fibrosis is often confirmed through numerous screenings, sweat chloride tests, and genetic testing. Management of CF is a complex and typically involves a multidisciplinary approach to address respiratory and digestive complications, nutritional needs, and other aspects of care with the goal of improving quality of life and lifespan. So lesson of sign is symptom of cystic fibrosis, progressive disease that can present with protein and fat malabsorption, liver disease, cholestatic jaundice, or chronic respiratory infection, chronic cough, poorly controlled asthma, but recurrent pancreatitis, nasal polyps, and chronic sinusitis can also be presenting manifestation. Digital clubbing is common in patients with CF. 90% of CF born exocrine pancreatic insufficiency inability to excrete pancreatic enzyme into the intestine leads to malabsorption of the protein, sugar a lesser extent, and especially the fat. Fat malabsorption manifests clinically as steatorrhea, large for smelling stools, deficiency of fat-soluble vitamin D, and failure to drive protein malabsorption to present early in infancy as hypoproteinemia and peripheral edema. CF-related diabetes may occur. The failure of CF gland conserve sodium and chloride may lead total hyponatremia, hypochloremic, metabolic alkalosis, reproductive dysfunction in both the male and females, congenital absence of class difference, and azoospermia and early universal. In females, secondary amenorrhea is often present. GH symptoms, meconium illness, failure to drive, malabsorption, extreme pancreatic insufficiency, steatorrhea, deficiency of fat-soluble vitamin, liver, and bowel duct abnormality, respiratory symptom, bronchiectasis, nasal polyp, recurrent productive cough, and pulmonary infection, hemoptysis, distraught loving, due to respiratory insufficiency, sweat gland, salty sweat, urogenital men, infantile woman with fertility, amenorrhea. Persistent cough, recurrent chest infection, wheezing and shortness of breath, nasal congestion and sinusitis, digestive symptom, poor growth and weight gain, steatorrhea, intestinal blockage, prolapse, intestinal obstruction syndrome, other symptoms and signs, salty tasting, skin clubbing, delayed puberty, infertility, additional complications, cystic fibrosis,